which resembles a cone tapering upwards, as a result of which each rib is longer than the next higher rib. As you can see over here, each rib is longer than the next higher rib on elevation. Okay, the larger lower rib comes to occupy the position of the smaller upper rib, which pushes the sternum forward. You can see the sternum is getting pushed forward. Okay, and there is elevation and lateral aspect of the ribs during inspiration. Okay, and this is also increasing the transverse diameter of the thorax. The vertical diameter is increased by a piston-like movement of the thoraco-abdominal diaphragm, which is also descending to increase the thoracic capacity in inspiration. Now, if we just like to summarize the factors producing increase in diameters of the thorax, number one, we have the pump handle movement, which is causing the elevation of the ribs, increasing in the anterior posterior diameter of the thoracic cavity. Okay, so the anterior posterior diameter is basically increasing by the pump handle movement of the sternum, brought about by elevation of the vertebrosternal, that is second to the sixth rib, and partly by the elevation of the 7th to the 10th vertebrochondral ribs. The transverse diameter is increased. How? By the bucket handle movement, elevation of the ribs. Which ribs? The lower 7th to 10th one, causing an increase in the lateral diameter of the thoracic cavity. This is basically by the bucket handle movement of the 7th to 10th vertebrochondral ribs. Number two, partly by elevation of the 2nd to 6th vertebrosternal ribs. The vertical diameter is increased by the descent of the diaphragm as it contracts, and this is called the piston mechanism. Okay. So what is the piston mechanism? Here you can see the diaphragm going up and down. This is the piston mechanism. During inspiration, the diaphragm contracts and comes down by 2 cm, aided by relaxation of muscles of the anterior abdominal wall. During expiration, the abdominal muscles contract and the diaphragm is pushed upwards. Okay. Right. This is expiration and this is aided by the intercostal muscles. And this is called the piston movement. You can see the movement of the thoracoabdominal diaphragm up and down. Now, this movement of this piston mechanism, it is facilitating inspiration of about 400 ml of air during each contraction, and females, the respiration is thoracoabdominal, whereas in males it is abdominal thoracic type.